Now, as Ugandans reflect on the presidential directive extending the stay-home measures by 21 days, there is concern about what may have informed the president's decision. In short, is there a science to this decision of 21 days? To help us answer this question and more questions, we have Dr. Richard Idro, who is the president of the Uganda Medical Association. Welcome to NTV Tonight. Thank you so much for coming, Dr. Idro.
Thank you and good evening.
Well, my first question, Dr. Idro, is you got into the presidency of the Medical Association in November, and then this pandemic happened. What's it like being in your shoes at this point?
Thank you for this interesting question. When we got in, this was certainly not part of our plan. Our plan was to work with the doctors of this country, focusing on their professionalism, focusing on training, and focusing on the welfare of the doctors. We also hoped to work on building a home for the doctors, something which we thought would be there. But come the end of December, boom, and we have had this, and yeah, it has been quite some work.
It's going to be interesting to know what it's going to be like after COVID-19 and how you're able to go back to those plans. But first things first, what is the science behind these 21 days? Why 21 days and not 28 if you do 14 plus 14 or 30 or 40? Why 21?
So the Minister of Health has a scientific committee, and this scientific committee is composed of 16 people of different backgrounds, and who examine the different aspects of this coronavirus, the disease, and how the health system can cope with it, and also how the health workers can respond. And they have put these things together in coming up to these 21 days. The first bit is the COVID-19 in itself. If any person is infected, that person potentially can infect 2 or 3 people, and then it multiplies. And that is the basis of the lockdown, that if you stop the contact between people, you may stop this transmission between individuals from one person to the other, until you reach a stage that a person who is infected can infect less than one person. That is where you start you start that element that now you are able to control the disease. And for an infected person, it takes usually between 2 days and 12 days for this person to develop the symptoms. And we stretch this to 14 days. So from the last group of people...
That explains the 14 days quarantine period.
That is the 14 days quarantine period. So from the last group of people who had been infected, now we, other than what has just come through the border, other than those, the scientific committee advised the minister that you needed at least 14 days, so that in case the people who tested positive exposed other people, it will have given them time to develop the disease. So which will have meant that beyond the initial 14 days of yesterday, we needed to add a minimum of 14 days. Okay. Now, the reason why it went to 21 days is additional things. Beyond the 14 days, some people might have had the disease. We need to prepare the community to receive them. We need the health system to be able to respond to them, the laboratory testing, and then we need to start organizing post-intervention periods, like how are we going to open schools, how is the health system booked, and the additional 7 days were added based on.
So the additional 7 days are preparation, really?
Yes.
It's not so much a lot to do with the virus and spreading it.
And that is hoping that we do not have additional infections during these 14 days.
You don't paint a pretty picture. Talk to me about protective wear for the health workers. That's been top on the list of things. How is that coming along? Do they all have protective wear here in Kampala and in the rural Uganda? No.
So this has, as a Uganda Medical Association, this has been our biggest headache. And over the past weeks, we have really engaged the Ministry of Health and the leadership of the different health units and the country about this particular element. There are different levels of protective equipment. Now, the reasoning is that by the time somebody comes to me, that person does not come with a label that I have coronavirus disease. It takes a bit of time for me to ask questions and examine this person before the person reports that before I make up my mind,
yes,
do a test that this person has COVID-19 infection. And unfortunately, in the equipment, the protective equipment has been inadequate, and because of this, Ministry of Health targeted the main treatment centers, and with the expectation that those who may fall sick from the disease will first present to the treatment centers. And at the moment, I'll say God's blessing has been with us, and we have not had community spread. The control measures have been fairly good, but it is very scary for our people. For example, the whole weekend, Kawempe Hospital, the women's hospital, really struggled with protective equipment to the extent that actually some mothers were buying equipment so that the health workers could wear. Today we have been with the supplies people in Ministry of Health. This is now starting, I understand this is now starting to ease, so that some equipment has been delivered, and the National Medical Stores is starting to take equipment, protective equipment around the country. Okay. But really, up to now, it is really inadequate. And it's our major call that this aspect is quickly addressed. When you speak about the equipment is in different categories, so you have the gloves, you have the masks. Yes. But then we see people wearing the full, outfit. Yes. How many people? Is it just the people at the particular centers with the full outfits? So what the full outfits, many of this protective equipment is coming from just very few sources. The companies producing, they are limited. Everywhere around the world, everybody is literally competing for the same resources. So as Uganda Medical Association, we have been working with the Ministry of Health, and we are now coming up with guidelines of how to rationally use this. And our recommendations are that any health worker who is coming in contact with patients in a healthcare setting should be able to have a mask, the basic surgical masks, and should have gloves. Okay. Now, if this health worker is say a dentist, or ear, nose, and throat specialist, or an eye specialist who is really engaging very close with the face of a patient, that person should have eye protection. So either face shield or goggles in addition to this mask. And should we suspect, should he or she suspect that this person may have COVID, that is, has cough, has a fever, in addition to difficulty in breathing, then that person need also to have the gown. Okay. And preferably these gowns we recommend that it is in the isolation units and in the treatment units. Are we focusing our energy also to the border areas, because now we see that's where our biggest problem is? Yes. So as part of this initiative, part of the 21 days is to give time for the regional referral hospitals to set up their systems, and two, there are 26 border districts which are also setting up quarantine centers and isolation centers. And for example, the Busia Malaba area, they are setting up such systems, and that was, I didn't mention it, but it's one of the reasons why we had the additional 7 days to prepare for that. And indeed, there is quite some focus on that, and including the testing of the truck drivers as we did observe in the news. All right. Well, Dr. Idro, we've heard that there's been a bit of frustration with the medical workers when it comes to their allowances. And I'm not sure if this is general allowances or risk allowances. And we've also been told that some workers have actually laid down their tools. Is this true? Now, what you did get initially as workers laying tools down were the intern doctors. So our intern doctors receive a monthly allowance, and this allowance is not fixed as a salary. And so sometimes there are delays, and sometimes there are delays in paying them. And in quite a number of units around the country, their March allowances have not been paid. And this has been the reason why some of them have laid down their tools. I think at point in note, especially towards some of the hospitals in the West, we have received complaints from Tiana, from Kabale, but they were addressed here by their leader. Now, about the COVID-19 risk allowances, that is a different entity. So in the treatment centers, there are other health workers who are working, and they are entitled to a risk allowance. And this risk allowance, to quite a number of them, has delayed coming. And yes, there's disquiet, but nobody has laid down their tools. They are working and working well at the moment. But certainly, yes, there's disquiet about it.
Is it being addressed? Is it something that is priority for the ministry?
Yes. So last week I did attend a meeting in the Ministry of Health, and I did raise this one up, and there's been discussion, and hopefully by the end of this week that we expect that the allowances will be paid, and this disquiet is sorted. But we do appeal that this one is addressed quickly.
Well, speaking of disquiet, there's also the issue of transportation for the medical workers. And we heard also that many stickers for the medical workers were also withdrawn today. I'm hoping you'll clarify on that. But also in a conversation I had with the PS yesterday, she mentioned that some of the buses that were meant to transport medical workers had been impounded. What is happening with transportation for the medical workers?
The lockdown came when inadequate measures had been put forward to cater for the transportation of medical workers. And this has caused a lot of trouble for us and for our functioning as health workers. Now, immediately the first lockdown was announced, we quickly put out a call to health workers to register so that we submit their names, and so that we get some form of identification, and to allow them to move. And this was submitted, and some stickers were taken to the Ministry of Health, but not actually the majority of health workers didn't get these stickers. There were very few who got these stickers, and it has seriously hampered the movement of health workers. But
we are told even the ones who had gotten some, that they were taken away today. Is that true?
That has not come to my notice.
Okay.
Yes.
How are your medical workers getting to work now?
So over the past 2 weeks, there has been quite a number of challenges, as I may say. Some medical workers have stickers, and they can move with the stickers, but we did meet the leadership of the security forces and discussed with them, and to the effect that we use our identity cards, so that when a health worker is moving and has an identity card and shows it out, they can be allowed to move. And the trouble is that we do not have a uniform identification. Some people are working with the university, others are working with research organization, so they will have a different title, not necessarily called a doctor, and this has created a lot of challenges. But partly this has been respected now in the past few days, but initially it had a lot of challenges. The other one is those who do not have their own means of transport. It was very difficult.
What are they doing now?
We had some people who literally walked to work. Others have remained at home, and in the past week we have worked with the Ministry of Health so that we have buses to move on some particular routes, and then they pick health workers along the different wards. And what you are talking about, I think there's a group of nurses from Naguru. Their vehicle was impounded around Chireka, but I can actually appreciate the impounding by the police. They were overcrowded, okay. And it is a very unfortunate situation that the health workers, it's because of the need to move, to come to work, they are being crowded, and that is actually putting their very lives at risk.
Yeah. All right. What do you as medical workers need the most?
personal protection
besides
equipment.
the because you've mentioned that one. That is the key thing.
That is the absolute number one. And that we need all health workers to have adequate protection. No health worker should die from serving people unnecessarily.
Right.
If that one can sort it, the other things are secondary.
All right. There's a message I saw earlier today, and I know we're out of time, but I think it's important that we speak to you while we have you. There's a message that was going around about a drastic increase in maternal deaths per week, and there was a graph that was showing that this increase is going to, grow further. It's going to increase further in the next 21 days. And we can't ask this question enough. Do we have special measures in place to help this situation?
Now,
that's a deep sigh. It speaks volumes.
It's a deep sigh. One, I have not yet seen that information or the source of the information, but it is one of our biggest worries that the lockdown in the lockdown of the population and people is impacting on access of patients to health services. For example, I have just been told by some of my colleagues in Nakaseke that the number of cesarean sections in a day has reduced from 4 to 5 down to 1 or 2. Now, that is worrying me. Where are the other people delivering? COVID has not stopped the other diseases. It has not stopped people from getting asthmatic attacks. It has not stopped people with epilepsy getting attacks. It has not stopped people with getting stroke. So how are these people accessing? Yes, we have met with the Ministry of Health, and we have recommended that beyond the RDC and the system of the RDC, let the health workers in the communities, at the health center 2, at the health center 3, be permitted to refer people, and that people who have any form of medical information saying that they are going for treatment, let them access treatment. We
saw the other day a nurse who helped a patient get to the hospital and she was being harassed by the local authorities. I don't know if you guys are involved in helping her situation so that she's not being harassed and her job or her life is not in danger, because they felt she embarrassed them,
I think the media has done enough.
All right.
Yes.
My final question to you. We had earlier today and late last night that President Donald Trump had cut funding to the World Health Organization. This definitely will affect us as well. How bad is this for us?
Now, I do not want to get into international politics. That will be the preserve of Ministry of Foreign Affairs and the Ministry of Health. But this disease is no borders. So if WHO fails to perform its duties in one part of the world or on another continent, it is more likely that it will go to other continents. So it is in every person's interest that the World Health Organization is supported to do its job. That's really the best I can say.
Thank you so much, Dr. Idro, for taking the time to speak with us. It's been a pleasure to have you.